Yeah, I think messaging to the end user, to the patient, that there's hope, there's help, and the more people that they can actually choose from to get that help, right? That they can find somebody more local to them, hopefully, not having to go so far. But we obviously want to make sure that that's done with care.
Yeah, and like, so it's not just the audiology community, ENT community, obviously. Tinnitus patients pass through the hands of a number of different professionals. So there's the family physician, the ENT, and then ultimately to audiology, right? So we need to make ENTs aware that there are solutions now, because a lot of patients will have heard the message, oh, there's really nothing you can do, you just have to learn to live with it, which is terrible. Like if you've woken up and you have a screaming noise in your head and you go to the doctor and they say, well, this is just your new reality, that's horrific. You know, so so we need to challenge that assertion. And I think that you know, really, that's why we've kind of taken this approach, you know, of high science, you know, top tier journals and whatever, because that's what changes the minds of ENTs and of all doctors, right? When they see publications in Nature, when they see publications in Science, when they see FDA, not only FDA approval, but FDA de novo approval, knowing that it went through clinical data, that the ENT group in the FDA reviewed this and approved it, when they see real world evidence published, you know, I think that is what will convince them. I don't think we'll do it overnight. I think, you know, we're going to have to work together with audiology, and you and I have been on one of those missions today, right, to try raise awareness among local ENTs. And I think it's going to be gradual. I do believe we'll get to a turning point where, you know, it'll, you know, we'll get there. You know, we're working hard to ensure that bimodal is you know, included in some of the guidelines which are being updated at the moment. So the Audiology Practice Standards Organization are updating their guidelines. The American Academy of Otolaryngology are updating their guidelines. So, you know, all
even
of that.
Even within the VA, there's been some
even within the VA, I think we were a little
guidelines.
late for that. They updated it before we got FDA approval. So hopefully they'll revise it and include it in it. But it was mentioned in there. And you know, but we'll continue to build the credibility of the technology, so that, as I said, you know, earlier, I want it to be like anesthesia, so people don't question whether it works. It's just when a patient comes in and sees an ENT, they will say to them, okay, here are your options, right? If hearing is more your issue, you know, go get a pair of hearing aids. If tinnitus is most likely your issue, go get bimodal. And if it's just psychological distress, then, you know, let's go see somebody about CBT. And then that disentanglement will have happened, and, you know, and then they can get the most appropriate form of care.
Get the proper path.
Yeah, exactly. Yeah.
Thank you for taking the time today.
You're very welcome.